Hello everyone and welcome to another video here on White Coats and Corgis. Today I'm going to show you a clip from the Premed Experience, which is a free event I created and hosted back in March 2023. The goal of this event was to connect pre-med students with admissions experts and make their advice a little bit more accessible. We talked with admissions committee members, deans of medical school admissions, and MCAT tutors. Today's clip is from our very last session of the day called Real Truth with Real Medical Students. All right, let's go ahead and get started.
Everyone, good to see you all again, and thank you to our medical students for joining. Again, I'm Dan. I am a second year internal medicine resident, and I'll be moderating the panel. So I'll be looking for questions in the Q&A portion below. But first, again, I want to thank our medical students for joining us, and I'm going to go one by one, and you just introduce yourself if you can, and tell us what year you're in and maybe what specialty you're interested in. And the first person I see here is Angela.
Hello, everyone. Thank you so much for having me. I'm super excited. My name is Angela Rakowski. I'm a rising third year. I'm at Rush in Chicago, and I'm currently interested in OBGYN or neurology, keeping an open mind. Definitely very excited for rotations.
Awesome. Next, I see Brooke.
Yeah, hey y'all, Brooklyn. I am a fourth year medical student. Cannot believe it. So on edge with match next week. I'm in Texas, and I also am finishing up my MPH during medical school, so that might be relevant to someone. And I'm kind of revealing what I'm applying to soon, but it's more like primary care focus and trying to incorporate public health in my career.
Awesome. Next person I see is Zara.
Hi, I'm Sarah. I'm in South Florida. I'm a third year medical student, and I'm currently interested in emergency medicine, but it changes like every day. So stay tuned.
Fair. And the last person I see here is Kinza.
Hi, everyone. I'm Kinza. I'm a fourth year medical student. I'm actually here in Massachusetts, and I am applying psychiatry.
Thanks. Awesome. And Zara, a question for you here about shadowing from way back earlier, but I found a question here about shadowing. And could you talk about your experience with shadowing? Did you shadow? How much? How did you find your opportunities? And is, with now, in COVID and changing sort of landscape of these opportunities, is virtual shadowing okay, do you think?
So that's a really good question. I have not done any virtual shadowing, and I don't know enough on that to speak about it. One thing I would recommend is that I do think that being in the clinical setting in person is an experience that you really, really, really should have before going into medical school. A lot of times the situations that we see on TV or like what you might have in your head about medicine might be very different from what it is like in clinic or like in the hospital. So in terms of shadowing, I started off working with a psychiatrist, and then I did some family medicine. I was a volunteer scribe at an underserved clinic. And then I worked with a physical therapist, which is kind of not in the physician category, but it was still a really, really great experience. So that's one thing I would recommend. You don't have to limit yourself to physicians. There are other fields in healthcare, and that's a good way to get in your clinical hours as well. And you do get to see like a different side of medicine from a different like career perspective. I do think you should work with physicians though. It's a great experience to have. And you do learn a lot, and it's a good connection to make, and you really get to solidify if that's what you want to do versus other career paths. And I think I want to say I did close to like, I'm not sure how many hours. I want to say maybe like 200, 300, if I'm not mistaken, but I don't really remember that well.
All right, awesome, thanks. And during our previous session, we talked with the admissions deans about like numbers and amount of hours and things. So it's very variable, and there's really no specific cutoffs anyone looks for. It's just you want to make sure that you're getting a chance to see what it's like to be an actual doctor and deal with patients, because that's something that you can talk about in interviews and really helps make the decision of, do you want to be doing this?